Welcome to the Research Highlights podcast series presented by the Substance Abuse and Mental Health Services Administration Suicide Prevention Branch. This series is part of an effort to bring research findings with critical public health significance to the prevention and treatment communities. I'm Chelsea Booth, Public Health Advisor and your host. Today's episode features Dr. Marsha Linehan. I'd like to welcome Dr. Richard McKeon, Chief of the Suicide Prevention Branch, to introduce Dr. Linehan.
Thanks, Chelsea. It gives me great pleasure to introduce Dr. Marsha Linehan. Marsha is a professor in the Department of Psychology at the University of Washington and director of the Behavioral Research and Therapy Clinics. I've been familiar with Marsha's work for about 20 years, since the days when I was working in community mental health. And we're working with numerous people who had made repeated suicide attempts, and I did not think that we were really being able to help them effectively. So I started to kind of look around to try to find out who was doing work that seemed to be meaningful and more helpful than what I was familiar with, which led me to the work of Dr. Linehan and Dialectical Behavior Therapy. I then had the pleasure of receiving some training from her and starting a Dialectical Behavior Therapy program in New Jersey. I think that no one in the suicide prevention field is really better at translating science into meaningful treatment, intervention, and prevention strategies. And the biosocial theory that she created regarding the development of chronic suicidal behavior, particularly for those who meet diagnostic criteria for borderline personality disorder, I think has implications for prevention, as well as the treatment that she has developed has also been applied specifically for youth. So with that, it gives me great pleasure to introduce Dr. Marsha Linehan.
All right, Dr. Linehan, we are obviously delighted to have you here today, so begin whenever you're ready.
Okay. Thank you very much. I'm delighted to be here myself, and I actually very much appreciate the opportunity to do this and the request that I do this. If you look at just my first slide here, you can see that it starts with real change is possible. And I love this title personally because not only is it true, but it seems that so few people actually believe real change is possible, particularly all the people that I deal with. And I run a program and research programs with both adults and with adolescents, and once you get adolescents, you get their family and you get their parents, etc. So the reason this is called DBT Skills Training for Families is because these skills are so applicable really across the board. We run an adult program for highly suicidal individuals. I'm also currently in the middle of a large research project for extremely high risk for suicide adolescents. But we also, in my clinical training program for graduate students in psychology, we run not only adult programs, we run an adolescent program, but one of my very favorite programs is the Friends and Family program. So we run a whole skills training for all of these different groups. So the reason I put down training for families is really it is training for anybody. And what's critical to understand about this is that we have people who come into our training program who are extremely suicidal, have multiple 4 or 5 different diagnoses, from post-traumatic stress disorder to everything you can think of, depression, eating disorder, anxiety disorder, plus suicide. So that's one group. And then we have our adolescents who come in wanting to be dead. Excuse me for coughing. And then we have our friends and family where if they do meet criteria for a major disorder, we actually don't even let them in. Although we always have a rule, we don't help people change other people, we help you change yourself. So these skills are reasonably broad. You're going to be happy to find out that I'm not going to put a whole focus here on what our research findings are, although I will, before I start, just make a comment, which is that we know that skills alone do reduce suicidal behavior compared to people who don't get any skills at all, don't get any treatment, in other words, compared to a wait list. We also know that in a treatment program where people get skills training, obtaining of skills training and the use of skills is highly related to subsequent suicidal behavior or self-injury. And we also know that for people who come in with lots of difficulty regulating emotions, but no other major mental disorders, that just taking the skills, learning the skills, reduces emotion dysregulation. So in general, DBT skills are widely applicable, and it's important to make that point because if they're only associated with borderline personality disorder, you often find people who don't want to learn them. In fact, I find people don't even want to talk to me in the grocery store because they think if they do talk to me, someone might think they have borderline personality disorder, and borderline personality disorder is the most stigmatized disorder in the area of mental health. So it's important to remember, first of all, we're against all that stigma, but second, when there is stigma, we want to remind people that they can learn a set of skills without necessarily getting labeled as having a severe disorder. So with that said, I'm going to go forward. Before I do anything, I've got to tell you about my conflicts of interest, and I have so many that you might want to take everything I have to say with a grain of salt. So not only does NIMH support my research, and they support research on treatments, all of my treatments involve skills. I get royalty for 3 different books from my publisher, and all the books talk about skills, among other things. There are a lot of different groups very willing to pay me to train and teach DBT skills, so money comes into me and comes into my research clinic primarily. And I own a company, Behavioral Tech Research, that develops and sells online skills training and is kind of moving towards online treatment period. So once you see all that, you can see that I definitely have conflicts of interest. So you have to keep that in mind when you listen to what I have to say. So I'm going to start out with what are DBT skills, and in a sense, what are skills in general. So DBT skills are a set of skillful behaviors that are designed to increase various types of behavior. And at the moment, we have 4 major categories of skills. First of all, we have a set of skills that teach mindfulness and how to interact in the world mindfully without being judgmental and staying in the present moment. So we spend a lot of time, particularly in our adolescent program, working on non-judgmentalness. We try to teach the parents to be non-judgmental, and we try to teach the adolescents to be non-judgmental, and we try to get them to be non-judgmental of each other. Now, with adolescents, just to be clear, your biggest task is to how to get them to stop being judgmental of themselves. So we have an entire set of skills really aimed at that. So that's set 1. Set 2 is we have a lot of skills that have to do with how to be interpersonally effective. And those skills are how do you ask for something and be effective enough that you actually get what you ask for? How do you ask for something, get what you ask for, but maintain a really good relationship with the person that you're getting it from? And how do you ask for something, not only get what you want, not only keep the relationship, but keep your self-respect? In other words, how do you interact interpersonally in such a way that you maintain your own values and your own self-respect? So that's Section 2. Section 3, which many people think are the most important, but really are important, but all of them are important, is emotion regulation skills. And these are skills which really focus on how do you increase emotions that you want to have and how do you decrease emotions that you don't want to have. So the most important thing here is to recognize that we're talking about regulating emotions, not getting rid of emotions. This is an important point because a lot of people who come into our program immediately think we're going to try to get them to stop feeling whatever it is they're feeling, which is not what our goal is. So that's 3. And then 4 is a set of skills which we call distress tolerance skills. These are really these are kind of a 2-part section of the skills. Section 1 is how do you get through a crisis without making things worse? Okay, so all of us have crises in our lives at times, and many people, when they're in a crisis, start engaging in dysfunctional behavior that actually make things worse. For example, you have a crisis, it's so terrible you can't tolerate it, you can't stand it, so you decide to use drugs, or you decide to drink alcohol, or you get angry and blow up and yell at somebody else, which often has a negative outcome instead of a positive. So that's one set of distress tolerance. And the other set of distress tolerance, my favorite set, to be honest, is what do you do when you have a life that's not the life you want? What do you do when you're in a situation that you actually can't change the situation, but you also can't leave the situation? So my guess is, if you really thought about it, almost all of us have to learn how to tolerate distressing events in our own lives that we actually can't change. And so the trick is, how do you do that without engaging in behavior that actually make the whole thing worse? So that's the 4 major sets. Now, later on in the talk, I'm going to tell you that we had to add extra skills for extra problems. Okay, so I'm going to go to the next one. Okay, and that is, are there skills that are specific for families? So have I had to make up a set of extra skills for families? I do have extra skills for families, but there are also some extra ones, although I wouldn't exactly say I'm the one who developed them, so I'll tell you about that. So the first thing is we try to have a set of skills to increase mindfulness of others. This is important for parents, it's important for adolescents, and it's important for their relationship with each other, which is essentially how to pay attention to each other. And it helps adolescents in their relationships in school, which is often a large part of their problem, is that they're having problems interacting with others, or for the girls with their boyfriends, for the boys with their girlfriends. Whenever I teach kids how to interact with their parents, I point out to them that the same skills will help them with their boyfriend or girlfriend or with their friends. The next one is how to validate yourself and others. In our adolescent program, I would say this is our single biggest problem. First of all, universally in our program, I can't say it's universally in the world, but I can say in our program it's true, we've got kids who have a suicide attempt already and who, when they come into our program, are very high on their desire to kill themselves. And without exception, each one of them have hated themselves. And you talk to them about themselves, and they find flaw after flaw after flaw. Teaching them to validate themselves, which is the opposite of finding what's invalid or wrong or bad about yourself, is extraordinarily difficult. The good news is, sooner or later, if you stick to your guns and keep at it, you can get them to see that they're going to have to work on this. And so we have a whole set of skills called self-validation. Now, self-validation skills are very similar to the skill of how to validate another person. How to validate, validation doesn't mean approval. It doesn't mean giving in. It doesn't mean this is okay. What it means is finding what is understandable in another person's behavior. It's really based on the idea that all behavior is caused. And therefore, if a cause occurred, the behavior makes sense. That's essentially what it is. And it's letting go of all judgmentalness and seeing how whatever has occurred cannot be otherwise given the causes for it. This, we have discovered, is very difficult to teach. Not to adolescents. Adolescents, I'm not kidding, are very good at learning how to validate their parents. The problem is getting the parents to learn how to validate their kids. Why is that? It's because many adults believe that if you validate another person's emotions, in other words, say, I can understand how you would feel that way, people tend to believe that if you did that, the emotion will go up instead of down. Now, it's exactly the opposite. If you validate someone's emotion, say, I understand it, I can see how you feel that way, it makes sense when you tell me the story, often a person calms down. So we get the parents ultimately to learn this, but this is one of our best skills. Now, the other thing that we've done, and the rest of these skills were developed by a colleague of mine, and it's the behavioral management skills and avoidance of extremes by practicing dialectics. So the avoidance of extremes by practicing dialectics are a set of skills where what you learn to do is notice, when are you being extreme? When are you going to, I'm either right or I'm wrong. You're either good or you're bad. You're either lonely or you're not lonely. In other words, the notion that opposites can go together, that you can bring opposites together. And the other idea of dialectics is that it's important to look for what are you missing in your understanding of a situation. In other words, what information do I not have? So there's a lot more to dialectics than this, and this is not a time to really teach this. But the point is those skills are in there, and they were brought in primarily for adolescents and their parents. The other set that came in is behavioral management skills, which is how to change your own behavior and the behavior of others by managing consequences. So almost all behavioral management skills or parent training really does focus on this. We're not a parent training group. In other words, we didn't develop an entire parent training set of skills. But it turns out that one of the important things to do when you've got a group of adolescents and their parents in therapy is that you have to teach the parents how to use contingencies or outcomes or consequences, whatever you want to call it, effectively. Now, we teach the kids how to do the same thing, and we point out to kids that if they would learn how to use consequences well, they could actually change their parents' behavior. But also, they can work on reinforcing things that friends do that they want them to do more of, etc. So all of these skills we teach. And the ones that you see on your slide here, number 3, 4, and 4, these were put together by Alec Miller. Okay, so let's go to the next slide. Now, you may wonder whether skills make a difference, because if you go into a skills training class, the question is, does anybody actually act more skillful after they do that? This is actually a very important question, because it's very easy for a person to come into either a treatment program or a skills training program or a class, and you kind of intellectually learn the information, but then you never do anything with it. So getting yourself to do something with things is actually very important. So this particular slide is saying that, in general, in our experience, people who've come into our programs, not only do they learn the skills, but they actually use the skills. Now, here's what's really interesting. If you look at this particular slide and you look at the red line and then you look at the turquoise line, okay? And what you see is people in DBT, that's the ones who are in the red line, that's people in a DBT skills program, they increase in their skills use. But what you'll see also is the turquoise line people, those are people who are in other treatments, not skills training programs, they also increase when they're in a therapy program. The important outcome here is to look at what happens. See that white dotted line going from top down to bottom? So look at that. What's on the other side of that is follow-up. In other words, that's when they're out of therapy. So what you find is people come into a DBT skills training program, they use them more after they get out of therapy than during therapy. In other words, they keep improving, and the people in other treatments go down, okay? Now, what that means probably is DBT skills training, this may be true of any kind of skills training, but we just happen to have research on DBT skills training. It could be any program that you get in where the focus of the treatment is on skillful behavior, and you have to practice it while you're in the program, and you get a lot of reinforcement for practicing, you're going to keep those skills. Whereas when you go into what could be thought of as a talk therapy, where you just talk back and forth with a therapist, it could be that because of that, while you're in that therapy, you will be more skillful. But then you kind of lose it afterwards, because many therapies are talk therapies, but they don't really focus on teaching and practicing specific skills, which DBT does. So, in fact, there is a change in use of skillful behavior. This is good news. Because if there wasn't, what's the point of teaching them? Now, the fact that you practice skills doesn't mean that it does you any good. So the next question you have to ask yourself is, do the skills do you any good? So when you use DBT skills, does it influence clinical outcomes? That means that do the skills make you get better, okay? So the research we've done on this is we look at people who use skills at one time point, so time point A, and are the people who use a lot of skills at time point A, do they look better at time point B? In other words, the next time point. Sorry for all the coughing. So this is what our findings are. If we look at people who use skills at time point A, and then at time point A, we also measure how well are they doing in regulating their emotions. And then we compare the people who use a lot of skills at A with the people who don't use a lot, and we look at them at time point B. The people who use skills have many fewer difficulties in emotion regulation. Not only that, but their interpersonal problems go down. Even better, not only that, but suicide attempts and self-harm goes down. And there's an increase in mindfulness. So in other words, our data suggests, it doesn't exactly 100% prove because you really have to replicate stuff, frankly, to really truly believe in it, but our data suggests that if we can get skills to go up, the next thing that will happen is that problems will go down. So this is a good thing, and it suggests that it probably makes sense to teach skills. Let's go to the next one. Now, I developed this entire program of dialectical behavior therapy. I just realized I might have forgotten to tell you what DBT means, but that is what it means. It means dialectical behavior therapy. So while I'm on the topic, I might as well tell you what the word dialectical means. In other words, where in the world did that come from? And that came from the point of view that when I started trying to develop a treatment, my focus was on changing the patients. They came in, they wanted to kill themselves, they walked in, I said, no problem, I'll help you change. Their position was, what do you mean you're going to help me change? You're saying I'm the whole problem. What about all these terrible things in my life that are happening? So what I ended up having to do and realized that I had to do is I had to come up with a strategy. Sorry, again, for the cough. I had to come up with a strategy that focused on two things. One, I had to help them change. But two, I had to teach them not only to accept themselves, but I had to teach me, the therapist, how to accept them. In other words, if you just focus on change, things can blow up. Unfortunately, if you just focus on acceptance, things can blow up just as much, because when I tried that, and when I tried that, all the people I work with said, what's wrong with you? You're not going to help me change? So I'd say, oh, yes, I am. So this back and forth between acceptance and change, dialectics brings together opposites. And the opposites in this particular case are acceptance on one end and change on the other. The idea is you have to have both. So that's where the term dialectical behavior therapy came from in the first place. The underlying theory of the whole shebang is that people who want to be dead because they're miserable. Not only are they miserable, but they have extraordinarily painful emotions. And they can't regulate or change those emotions. In other words, the harder they try to stop being miserable, the worse things get. So they experience their lives as lives not worth living. That doesn't mean they're not worth living. It just means that that's how they experience them. And to change that experience means that I had to figure out a way to help them change how they feel. In other words, go from being miserable and unhappy to at least neutral and possibly happy. So that's basically what these skills are all about. Now, what you're seeing here is a list of a number of the skills that we teach for regulating emotions. And our strategy here is to follow a model of emotions that I've developed, and out of that model came these skills. So what I'm going to do next after this is we're going to go through just a few of them and talk about what they are. So we've been talking about skills, so I figured, good person that I am, I'm going to teach you some of my very favorite skills. So this just gives you an idea of what some of the skills are. So One of the first skills is check the facts. Now, this is an emotion regulation skill primarily. Have you ever noticed how many times your emotion actually has nothing to do with the facts, but it has to do with your thoughts about the facts? So often what happens is some event happens. You're at the mall, you see a friend walking by, you wave at the friend and say hi. The friend seems like they're looking at you and just walks right by, at which point you decide, they're a snob, or they don't like you, or they don't want to talk to you more. You must have said something to hurt them, et cetera, et cetera, et cetera. Okay. Then you find out later that, in fact, they just didn't see you. This is a widespread thing for all of us, which is that we respond to our thoughts about events instead of the events themselves. So that's the first. An event leads to thoughts, which leads to emotion. Now, the other thing that often happens as an event leads to emotions, which then leads to thoughts. In other words, that we're being controlled, in effect, not by the event, but by our emotions. So a lot of what DBT does is teach people to check the facts. Now, the real asset of this particular skill is not that it's unique, because this is really cognitive therapy in a box, basically. It says to people, look at your thoughts and check them and see if they fit reality. The big difference is we're never telling people their thoughts are wrong. We're never saying you've got an irrational thought and a logical thought, or there's something wrong with the way you think. What we do is just say, did you check the facts? So I'll give you one of my better examples. As we had one time a person who came into therapy really angry at her boyfriend. This is one of our adolescents, really angry at her boyfriend. Why was she angry at her boyfriend? Because she and her boyfriend were supposed to go out one evening together, and she came home and her boyfriend had fallen asleep. So she figured if he fell asleep, he really didn't love her, and therefore she didn't want to go out with him. She threw a tantrum. It really created nothing but trauma. Okay. However, when she checked the facts, she found out later, of course, too late for that evening, but she found out that, in fact, he'd gone to sleep so that he'd be wide awake when the two of them went out. In other words, his taking a nap was an act of love, as opposed to not love. So that's a really good example of where you can, if you have a lot of examples, you can really teach people how to check the facts, which is look to see if your interpretation is actually the correct interpretation. So I've had many clients come in to me to say, Marsha, I really messed things up. I forgot to check the facts. So check the facts is a very non-judgmental term. That's why one of the reasons people like it. So it's not any different. There's nothing creative from my part here. I just took cognitive therapy and made it into a skill, and people really do like that skill. Let's keep going. So the next set of skills, my favorite set altogether, are what are called opposite action. An opposite action is a skill that you use when the emotion you have is not justified by the facts. In other words, if you have an emotion that doesn't fit the facts, or if you have an emotion where acting on it's not effective. So I'm just going to teach you the skill and go through it, okay? So the first thing you have to understand about this is when is an emotion justified? And an emotion, we're going to call justified emotions as emotions where the action on the emotion fits the facts. Now remember, you may not know this, but I'll tell you. You want to remember this. Every emotion has an action urge. Okay? So like sadness usually has an action urge of withdrawing, being quiet, doing nothing. Anger has an action urge of running towards something, protecting yourself. And fear has an urge of either freezing or escaping or running away. So we're going to use the example of fear here. When is fear justified? Fear is justified when your emotion fits the facts, and that means there's something dangerous. So an example would be fear is justified when there's a large poisonous snake in your office. Okay, so you get to the office, you walk down to it, and you find out there's this somehow poisonous snake got into your office. Okay? So in this situation, you know there's a poisonous snake there. What do you want to do? If you're afraid of a snake in your office, you want to avoid it, right? So you act on your fear. You stay out of the room, but also you problem solve. So when your emotion fits the situation, but you want to change the emotion, that's when you do problem solving. So you stay out of the room, call the snake handler, and get them to get the snake out. Okay? So that's an example of fear fitting the situation. However, what about having a fear that doesn't fit the facts? So what if there was a snake in your office yesterday, but the snake is not in your office today? Then does it make sense to avoid your office since there's no snake in your office? So your fear of a snake is not justified when there's no snake in your office. It could be understandable. You could validate it as understandable. You could say it's understandable you'd be afraid to go in there since there was a snake in there yesterday. So it's understandable, but it's not justified by the facts because there's no snake in there. So when that's the case, you want to act opposite to your action, open the door and go in your office. Because the only way you'll get the fear down is to go into the environment so that the information from the environment can change how you feel. So we'll just keep going with this idea. There are times when an emotion can fit the facts, but it's not effective. So an emotion is effective when the actions of the emotion go with an action is effective when the actions that go with the emotion are adapted to the situation that prompted the emotion. Okay, so if there's a snake in your office and no one else is in there, then avoiding it is effective because you reduce the chances you'll be bitten by the snake and die. But what if there's somebody in there, namely your toddler just walked into the room? Then keeping the door closed and avoiding it is not effective anymore, even though if it's the facts of fear, it's not effective because you've got to get your kid out of there or your kid might get eaten or bit by the snake. So then you open the door, grab the kid, close the door, and stay out. So there are a lot of situations where you have to think about, does my emotion fit the facts, and is my emotion effective? When your emotion doesn't fit the facts, and acting on your emotion is not effective, you do opposite action. An example of that might be, for a lot of our clients who didn't have jobs, is the question of, I'm afraid to go apply for a job because I'm afraid I won't get it. Okay? Now, the first thing you have to ask, if you need a job, but you're afraid to go for a job because you're afraid you won't get it, is that effective or not effective? So we can, I think, all agree it's not effective. Okay? Does it fit the facts that you won't get the job? That's an iffy question. You may not get it, but it's still not effective, so you do opposite action and you go. When you have a depressed person who doesn't want to get out of bed because they're depressed, is that effective? No. So then you have to get out of bed. So opposite action really is designed to get you to act in effective ways. It's one of our best skills. All of our teens like it. It's not their favorite, but they all like it. I'll tell you their favorite later. So I'm going to go through some skills here, and you'll be able to go through them more than once yourself if you watch this. I don't have enough time here to explain them to you, so I'm just going to go through them and let you know that all the emotions have facts that fit them, and every emotion also has an opposite action. So this is something for you just to read on your own by going through it again. Remember, if your emotion fits the facts and you want your emotion to change, so let's say you are very distressed because you're getting bullied at school, which is a major problem for our adolescents who are suicidal, then what you have to do is work on problem solving. So you have to figure out a solution so that you stop being bullied. That might be getting your parents to go to the head of the school. It might be working in a club or a group who's trying to get bullying to stop. Or it might be going to another school. There are all kinds of ways to work on that kind of problem. But the basic idea is when the problem is there, your emotion fits the facts, then what you do is you move to problem solving. And that means you either change the situation or you leave the situation, one or the other, or you avoid the situation. So let's say you get bullied at one door but not at another door, you go through the other door. So this is another one on opposite action just to keep you going. When your interpretations of the facts is the problem, opposite action is the thing to do. You do opposite of what your urge is. So It was just repeating the same thing. And once again, repeating again, when the facts are the problem, but acting on urges will make matters worse, you do opposite action. That's the one where if you leave your toddler in there, you're in worse shape if you don't get the toddler out than if you go in and try to. Now, I'm going to end with my all-time best skill. And I love this skill. It's called Copa Hat. Now, the important thing to recognize is this. You can actually learn new behavior by imagining the new behavior in your mind. I kind of think it's like a miracle or something. So you don't actually have to practice stuff in the real world. You can practice it in your imagination. So the idea here is to think through what event are you right at the moment afraid of. And when you're afraid of an event, then what you can do is you ask yourself, what's the threat? In other words, what's the catastrophe? What could happen? So let's go back to the person who's afraid to apply for a job because they might not get the job. Okay? So in that one, what you would do is you say, okay, so the tragedy that could happen or the threat is not getting the job. So we're going to imagine applying for the job, not getting the job, and then how would you cope with not getting the job? So you have to figure out a coping strategy. So the coping strategy might be to apply for another job, to ask the person why you didn't get the job. That would be a second strategy that you could do. I didn't get the job. I'll call them up and ask them why not so I can learn something about getting one. Or another strategy would be, let's say you're very distressed and you're afraid that if you do this, you're going to go have alcohol or take drugs. You could practice doing something else, like you could practice talking to your partner, talking to a friend, calling your therapist, using other skills that you have, emotion regulation skills, et cetera, et cetera. So the idea here is for, in any given situation, to practice what you would do ahead of time. So I had one of my adolescents, a lot of the adolescents like this. I had an adolescent who was going to sing at a choir, and she had to do a solo. But her problem was the week before, she had lost her voice. She had a cold and other problems and lost her voice for a while. And she had it back. She was terrified that when she got up to sing, she would be so scared that she wouldn't be able to sing. Nothing would come out of her mouth. Or that if she tried to sing, she might lose her voice for a few moments. So I said, okay, you got it. So the problem is going to be that you're going to open your mouth, nothing will come out. She said yes. I said, okay, you're in luck. That actually happened to me once in front of a whole group of people. It's hard to believe since I talk so much, but in fact it did happen. And so I said, so what did I do? First of all, I noticed that nothing was coming out. And so I almost panicked. But then I bent over and started coughing, figuring that if I did that, I'd get relaxed and organize myself and be able to stand up. So I told her, I said, okay, here's the thing. Practice that. Practice going to the concert, starting to sing, and all of a sudden having nothing come out of your mouth. And then practicing your mind, bending over, coughing for a while until you calm down, bring yourself back up and singing. I said, now just to make sure you don't practice only failure, also practice singing through the whole thing. She came back the next week. She said, I can't believe it, Marsha. I did opposite action, and I was completely relaxed because I'd already practiced everything bad that could happen. So the key to practicing opposite action is you have to figure out what is the real threat. This is where most people make their mistakes. You have to figure out what's the real threat. What are you really afraid of? And then you figure out if that real thing happened, how would you cope with it? And then you imaginally, in your mind, go through that scenario over and over and over until you get kind of comfortable with it. It's really remarkable. It's a very effective skill. So I want to recommend that you try it. So next. This is more on Copa Hat. It's just giving you the instructions that I just gave you on the last slide. I'm going to leave it up for a minute just so you can look at it. These are slides I'm hoping that you can continue to go over because if they do, you can kind of learn the skills a little bit better. One thing I say here, though, is actually very important to keep in mind is that when you're imagining, you have to imagine as if it's in the present tense. The way you can know that you're doing that is in the present tense. When you're imagining, if you can see yourself in your imagination, then you're not really in this situation. If you're watching it like on TV, you're not really in it. So what you have to do is imagine being in the situation and practicing it in your mind to Okay, so that's really important to keep in mind. Now, this is the skills that I was talking about in the distress tolerance skills. I know this is hard to imagine, but when we asked our teenagers what was their very favorite skill, they told us radical acceptance was their favorite skill. Once they talked about it for a while, I could actually start understanding it. Radical acceptance is the practice of accepting the moment as it is. The problem with radical acceptance is that you can't make yourself do it. In other words, you cannot tell yourself to accept something and then accept it. It's a little bit like emotions, where you can't tell yourself to quit feeling something. So the only way you can get to radical acceptance, and radical acceptance means complete and total acceptance. The only way you can get to radical acceptance is to practice it by turning your mind to acceptance over and over and over and over, okay? So you just keep turning your mind. So the first thing you have to do is actually decide that you're going to accept something. Now, a lot of people don't want to do that because they think, oh, if I accept it, that means I approve it, and I'm not going to approve it. Acceptance has nothing to do with approval. But I will tell you, if you don't accept reality as it is at the moment, you can't change it. Most people don't realize that. But just imagine what would happen if your brakes on your car broke down, you took it to someone to fix it, and they said, no, there's nothing wrong with your brakes, when in fact there is something wrong with your brakes. How fast do you think they would get it fixed if they said, I don't accept that, there's nothing wrong with your brakes? The only person that's going to fix your brakes, the person who accepts there actually is something wrong with your brakes. All of us have had this happen at times. We say something's happening and another person says, no, it's not, so I'm not going to fix it. So radical acceptance is actually required if you want to change something. So all radical acceptance is really is saying what is. And it's remembering that everything is caused, that it's not there arbitrarily. It's there because there's a cause. So what is, or everything is caused, or there's a reason for it. So there are all kinds of lines that you can use that help you. But the facts of the matter are the only way to accept is to practice, practice, practice. And it's really kind of a miracle, but if you practice, if you turn your mind towards acceptance, you say, I'm going to accept, and you move your mind over. If you do that for a long period of time, sooner or later, somewhat like a miracle, you've all of a sudden accepted. So the idea is to throw yourself into willingness that reality is. In other words, it's deciding that you're going to stop fighting reality. Doesn't mean you're going to stop fighting to change reality. Just means you're going to stop fighting reality itself. And this, in some ways, is the key to every single solitary skill I teach. Because you have to see reality to change reality. You have to notice reality to change reality. It's not 100% clear that you've learned a lot from this. I hope what it's done is make you want to learn some skills, especially some of our totally fabulous skills. Opposite action. Good one.
Well, thanks to you, Dr. Linehan, for being with us today. I'm sure the audience will appreciate all of your insights on DBT, and especially those last ones. I found those very helpful. So to our audience, I thank you for listening to this edition of the Suicide Prevention Branch's Research Highlights. If you have any questions about today's presentation or suggestions for topics you'd like to see highlighted in future editions, feel free to drop me a line at the email address on your screen. So on behalf of the Substance Abuse and Mental Health Service Administration Suicide Prevention Branch, I thank you all for listening and for your continued interest in suicide prevention. We look forward to seeing you again for our other research highlights.